Are you or a loved one facing a complicated urinary tract infection, UTI, that just won't respond to standard treatments? Contepo Fosfomycin for injection offers a new approach, specifically designed to combat tough bacterial strains. This video will explain how Contepo works, its uses, and important safety information you need to know. Contepo is an intravenous antibiotic used to treat complicated urinary tract infections, UTIs, in adults. This includes severe kidney infections, known as acute pyelonephritis. It targets specific bacteria like Escherichia coli and Klebsiella pneumoniae. This medication is particularly important because it can be effective against multidrug-resistant MDR bacterial strains. These are bacteria that have become resistant to many common antibiotics, making infections very difficult to treat. Contepo has a unique way of fighting bacteria, making it a powerful tool against resistant infections. It works by disrupting the essential process of bacterial cell wall synthesis. This means it stops bacteria from building their protective outer layer. The active ingredient, fosfomycin, enters bacteria through special transport channels. Once inside, it permanently blocks an enzyme called MRA. This enzyme is crucial for creating peptidoglycan, the main structural material of bacterial cell walls. Without a functional cell wall, bacteria cannot survive and die. This bacteria-killing effect, known as bactericidal action, is highly effective against the Enterobacterales family of bacteria, which includes E. coli and K. pneumoniae. Contepo is specifically approved for complicated urinary tract infections, UTIs. This includes acute pyelonephritis, a serious kidney infection. It is used when these infections are caused by susceptible strains of E. coli or K. pneumoniae. This medication is only approved for patients who are 18 years of age or older. Your doctor will determine if Contepo is the right treatment for your specific infection and health condition. Contepo is not suitable for everyone. You should not receive Contepo if you have a known serious hypersensitivity or allergy to fosfomycin. This also applies to any other ingredients found in the injection. Always inform your healthcare provider about any past allergic reactions you've experienced. Your safety is their top priority when choosing a treatment. Like all medications, Contepo can cause side effects. The most common ones reported include elevated liver enzymes, which your doctor will monitor. You might also experience low potassium, low white blood cell count, neutropenia, or changes in calcium and sodium levels. Other common side effects can include nausea, vomiting, diarrhea, headache, and low phosphorus. Your healthcare team will monitor you closely for these and other potential reactions during treatment. Contepo contains a significant amount of sodium, which requires careful monitoring. Each vial has 1,980 milligrams of sodium, which can lead to increased sodium levels, hypernatremia, and decreased levels of potassium, calcium, and phosphorus. Following a low-sodium diet during treatment is often recommended. Your healthcare provider will closely monitor your electrolyte levels and watch for signs of fluid retention. This is especially important if you have conditions like heart failure, kidney problems, liver cirrhosis, high blood pressure, or lung edema. Contepo may also affect your heart's electrical activity, potentially prolonging the QT interval on an electrocardiogram. Therefore, it should be avoided if you have known QT prolongation, certain heart rhythm problems, or a history of torsade de pointes. Increases in liver enzymes have been observed, so regular monitoring of your liver function is important. Allergic reactions, ranging from rash to severe anaphylaxis, can occur. Always tell your doctor about any previous reactions to fosfomycin. Low white blood cell counts, including severe cases, have been reported. Your doctor will monitor your complete blood counts throughout therapy. Like many antibiotics, Contepo can cause severe diarrhea due to Clostridioides difficile infection. Contact your healthcare provider immediately if you develop diarrhea during or after treatment. Before starting Contepo, it's crucial to provide your doctor with a complete medical history. Discuss any allergies you have, especially to fosfomycin or any ingredients in Contepo. Inform them about any heart conditions, including rhythm problems, or a history of QT prolongation. Mention if you have heart failure, kidney problems, liver disease, or high blood pressure. Also, disclose any history of fluid retention, lung problems, or electrolyte imbalances. If you have hormone disorders like hyperaldosteronism or blood disorders like neutropenia, your doctor needs to know. If you are on dialysis, this information is vital for proper dosing. Additionally, tell your doctor if you are pregnant, planning to become pregnant, or breastfeeding. Breastfeeding is not recommended during treatment and for 24 hours after your last dose. Finally, list all other medications you are taking, especially those that can prolong the QT interval. Also, inform them if you are on a sodium-restricted diet. Contepo is administered by a healthcare provider in a clinic or hospital setting. It is given as an intravenous infusion, meaning it's delivered directly into your vein. Each infusion typically takes about 1 hour. The usual dosing schedule is every 8 hours, 3 times a day. For most patients with normal kidney function, the standard dose is 6 grams every 8 hours for up to 14 days. If you have reduced kidney function, your doctor will adjust the dose and frequency accordingly. For patients undergoing hemodialysis, Contepo is usually administered after dialysis sessions. This is because a significant portion of the medication is removed during the dialysis process. Contepo can interact with other medications you might be taking. It's very important to tell your healthcare provider about all your current prescriptions, over-the-counter drugs, and supplements. Specifically, avoid taking Contepo with other medications known to prolong the QT interval. Combining these drugs can increase your risk of dangerous heart rhythm problems. Your doctor will review your medication list to ensure your safety.